And today I'm joined by Dr. Jeremy Heffner, General Surgeon with Midwest Surgical Specialists at Lima Memorial Health System. And we're going to talk about an innovative procedure that's now offered for patients who are suffering from Gerd, or gastroesophageal reflux disease. It's called the LINX Reflux Management System. So first of all, thanks for joining us, Doctor. And can you first tell us what Gerd is and what are the symptoms that patients might be looking for?
I think most people just consider this acid reflux. So, that heartburn sensation you get up into your chest. Some people actually get it all the way up into their mouth, and they can feel like or taste metallic taste in the morning, especially when they wake up. Some people get repeated episodes of reflux actually into their lungs and get recurrent episodes of pneumonia. So it can become a disease process that's quite life-affecting. But for most people, they're just going to experience that standard heartburn after they eat foods, especially spicy foods. Or large meals, and that's probably where you're going to most commonly see the symptoms.
Okay, so people that suffer from Gerd now have this new option for treatment. What exactly is this LINX Reflux Management System?
It's actually a pretty slick little device. So historically, we've been using medications to treat Gerd, and they're very effective. We know that long term. However, there are some people that are trying to get off the medications and to go to a surgical treatment. And for years, we've had some decent options, but nothing great. But this is basically it's a circle or a ring of titanium magnets. And so when you put the titanium magnets around the esophagus, as the esophagus opens or expands, these magnets expand with it and allow food to pass through. But it scars in and becomes basically a new sphincter mechanism or a way to prevent the acid from going backwards, which causes you to get the symptoms.
So what are the benefits of this procedure versus other options like surgery or just taking other medications?
Realistically, when you look at some of the studies, it's been quite interesting. One, the satisfaction rate appears to actually be better over time. We do see in some of the studies that about 93% of the patients were happy with the surgical procedure. When you get 6 to 12 months out, it's very effective. Once it works, it tends to work, as I say, 6 months down the road, 6 years down the road, or 60 years down the road. It's a good permanent solution to the problem and prevents you having to continue to take these medications, which, like anything else, taking the medications long term, we are finding there may be some side effects that we don't want to necessarily deal with.
And sometimes people are a little hesitant to want to go under in surgery. What can be expected with this procedure?
At this point, it typically takes about an hour to do the entire procedure. 42 minutes roughly average is what it's running us. We're very effective. My team does quite a few of these in a week. So we see them regularly. It's going to be multiple small little holes. We use something called the robot. So I'm sure around here most of you have heard of the robot, but we use that to place the device and to typically fix any height or hernia or anything that may exist at the same time. Afterward, the little holes are all closed under the skin, little glue over the top to protect those wounds so they can shower. We typically keep them overnight to learn the new diet, which is just for a week or two as they get used to this new device, and then they usually go right back to normal diet, normal activities in 2 to 4 weeks.
Okay, and if someone is watching today and they would like more information on this procedure, how can they reach out to you?
Just reach out to my office or to Midwest Surgical, and they'll guide you in the direction you need to go. But we'll get you and take a look at you. There's some testing that's involved. Obviously, like anything else, we got to make sure that you qualify. But we can have a long conversation about that in the office anytime.
All right, Dr. Jeremy Heffner, thank you so much for your time this afternoon, and we'll be back with more right after this.